think we can go ahead and get started as people come in. So welcome everyone to our Connecticut RFP Technical Assistance and FAQ session. Thank you all for joining, and we appreciate your interest in this opportunity. And as we all come in, I will just go over some reminders up top. So first up, we are recording this FAQ session. The slides were posted to that informational webpage back on April 9th, I believe. So they've been there, and we will post this recording to that page as well after this session. So during the session, if you have any questions, just put those in the chat and we'll be monitoring. We will also have time for an open floor for questions at the end. If you could have your camera on when possible, that would be great. Try to avoid distractions and be ready to participate. And then if you wouldn't mind sharing in the chat your name, your organization, and your job title so that we can see who all has joined us today. And if you need closed captioning, just go to the settings, then hit accessibility, then hit closed captioning. And so for our agenda today, first, we're going to learn about SBHA and our role in this RFP and the Connecticut Department of Public Health and their role in this RFP. We'll then identify information about this funding opportunity. We'll review the submitted questions that have come in throughout the application cycle, and then we'll have an open floor for questions. So while we do that, you can raise your hand or you can send in a question in the chat box and we'll monitor those. If you have any questions afterwards, you can always email us at ctsbhcfunding@sbh4all.org, and then we'll share some resources about school-based healthcare and centers. And before we get into that, we'll do some introductions up top. So my name is Teresa Bright. I'm a program associate with the School-Based Health Alliance, and I am a part of the team that is overseeing this funding opportunity. So I'll turn it over to my two colleagues to introduce themselves.
All right. Hello, my name is Teresa Dominguez. I'm Director of Programs. I am assisting with this RFP. Turn over to Danielle.
Good morning, everyone. Thank you again for being here. I am Danielle Dobbins, Director of Programs here at the School-Based Health Alliance, and we're excited to see you all this morning. Thank you. I'll turn it back over to Teresa B.
Thank you both. All right, so if you are unfamiliar with the School-Based Health Alliance, we do like to give an overview of the work that we do. So the School-Based Health Alliance is a DC-based nonprofit and serves as a national voice for school-based healthcare. All children and adolescents deserve to thrive, but too many struggle because they lack equitable access to healthcare services, and school-based healthcare is just one solution, where we bring healthcare to where students typically spend the majority of their time, which is in school. So since 1995, SBHA has supported and advocated for high quality healthcare in schools, and we focus on policy, standards, data, and training to support and grow school-based healthcare, the majority of which focuses around school-based health centers. So when health and education come together, that's where we see great things start to happen. You see attendance improve, you see chronic conditions being better managed, you see acute issues getting quick and expert attention, and healthy students make better learners. So with that, we do like to see who we have on the call today. And so we have a poll here that will launch, and then we'll keep that up for 30 seconds to a minute while everyone answers. And let me know if you, okay, I see responses, great. I'm seeing a variety of people. So a lot of mental health, medical staff. That's great. And if you're other, yes, please type that in the chat just so we can know who you are and what you do. But it's great to see a variety of people here who are interested in this funding opportunity, because I think some of the information that we're going to share is beneficial to all of you. So again, we appreciate you all taking the time to be on the call today. And I will just leave the poll up for a few more seconds and then share the results. We have almost all responses in. All right, so I will go ahead and end the poll, share the results. So you can see, yes, a variety of people on the call, which again is great. Stop sharing. All right, and then we wanted to briefly introduce the Connecticut Department of Public Health and their role. So they've contracted with the National School-Based Health Alliance to oversee this disbursement and administration of funds to support school-based health centers in Connecticut. And then I will turn it over to Teresa to go over award information.
All right, this is the moment we've all been waiting for. So the award is gives an opportunity for services in this sorry, excuse me, let me go backwards. So this award is for school-based health center, but also the services. The goal is to support students' health, well-being, and academic success with providing school-based healthcare. You could see the different types of services and care that's available. So mental health, primary care, oral health, vision services. And then there's also outreach to include, there's outreach that can be included, equipment, telehealth, mobile units, health promotion, and health education. So on our next slide, you can see the funding period. And I won't read all these, but some things I wanted to note that this is not a 1 year, it's longer than 1 year. So it's from June 2024, ending June 2026, which is a longer time period. And then we'll give notice of the grant May 29th. So yes, it's due soon. We want to get you to get your applications in. If you have questions, this is the time for that. If you have questions before you submit it, please communicate with us, talk with us, because you want to make sure that you have all the information to be able to have a successful application. The first grantee meeting is September 18th. And then this funding is currently a one-time, non-renewable, and non-refundable. So we just want to make sure that is clear. So we look at the awarded information, you could see that the max for each per school site, not max per organization, is $250,000. So again, that's per school site, not organization. And then the number of awards depends on how many successful applications we have. We look forward to having many successful applications. And we also will have a partial award if we see the need for that. So we'll go over these items a little bit further into our conversation with you all about what will make a good application. We're really looking to make sure that we have all the information to be able to make the best decision on who will be funded. So again, some things to keep in mind, these funds can award equipment purchases such as mobile units, telehealth infrastructure, and also minor alteration and renovation. So, and this would help to increase the number of school-based health service site clients. So thinking about that, we're gonna go on to our next slide where we talk about the details and what we're looking for. So again, the target populations are students who attend schools where the new SBHA medical and mental health services can be located. So again, our focus really is on the students who attend schools. And then looking at the different models, we're looking for a health clinic that is located in or on the grounds of a school facility of a school district or school board or an Indian tribe or tribal organization. Again, it needs to be in or on a school ground. Next is organized through school, community, and health provider relationship. So really looking at those partnerships there. That's why we're asking to see letters of support to know that you've already brought the school in and they're on board with what you're looking to do. And then the other part of it is looking at new or expanded comprehensive on-site medical and or behavioral health services to children and adolescents. And this will be in accordance with the various state laws and local laws that are in regards to licensure and certification. So just some key things to look on that slide is that the location of the site, new or expanded, and then there needs to be some relationships in place, especially with the school, the community, and that's why we're asking for some of the supporting documents there. So when we talk about new or expanded services, I just want to go in a little bit more detail to what that looks like. That could be providing medical, mental health services, and also it can include dental services, telehealth services, mobile vans, prevention service, or health education. Our goal, again, is looking at increasing the amount of services that are available to these students and making it accessible with it being in a school. And with that, we get to go into questions, and I'll turn it over to Danielle.
Thanks, Teresa. So we have some great questions that have been submitted over this period. So we wanted to first start off with our eligibility category. So the first question there, are only FQHCs or federally qualified health centers eligible? And the answer is no. Next, if the Department of Public Health does not currently fund an existing SBHC site, is it considered a new program? And it is new if it didn't exist as an SBHC site previously. Next question, if a school offers part-time behavioral health and medical care, would this funding cover expansion to full-time? For example, expanding from 2 days a week to 5 days a week. And the answer is yes. Next, would this funding cover behavioral health via telehealth or a medical care via telehealth? And the answer again is yes. So let's transition to our proposal category of questions. The first question, can one organization submit multiple proposals if we have multiple sites for which we're seeking to open or expand? Is there a limit to how many proposals an organization can submit? And although there's no limit, you must submit multiple proposals in that particular example. So for the next question, would it be acceptable to apply in a single proposal for funding to support part-time, rotating mobile medical school-based health services at 4 schools in a single district, or would we need to submit a separate proposal for each individual school? And so for this unique situation described, the answer is yes, one proposal is okay. You would just note the site information for all of the schools, and you can submit that via an attachment to your proposal. So the next question, are there specific geographic priority areas for this program? And so we just ask that you refer to the PA 21-35 report to pinpoint those areas of higher need. So let's continue with our proposal category of questions. A mobile van would address not having space for an SBHC and potentially also allow us to serve more than one school. If we are awarded funding for a van, it can take months to order a van and then get delivery. Would this delay be problematic? So it is acceptable to purchase a van. We just ask that you consider what else can be completed during the grant period, such as marketing, outreach training, and any other related services. Next question, would an approved grant be awarded to the Board of Education or subcontractor? This grant funds SBHC sites, so the organization implementing the grant will be approved, will be the approved grantee. And we just ask that you refer to the list of approved applicants within the RFP. So next question, is there a work plan template for the request? And there is not a template. We just ask that you do include the work plan and the requested attachments, and just keep in mind no more than 2 pages. So we will continue with our proposal category questions. So next up is, when providing existing site information on the proposal asks for information from the 2022 to 2023 school year. Is this time frame correct? And yes, it is indeed correct. The 2022-2023 school year will provide us with the most complete data. And our final question for this category, we anticipate seeking funding for sites that were opened last year with support from the SBHA and are dependent on external funding. Should these be categorized as new or expanded in the proposals? This would be categorized as an expanded site. Okay, so now we're going to transition into our budget category questions. We're going to start off with, is the Connecticut salary tier table the maximum allotment, or what are we required to pay personnel staff? So no, this is not representative of the maximum allotment. It is and should be used as a baseline to help with your budgeting. Next question, is there a limit to the amount of funds that can be used for minor A&R or alterations or renovations? So the maximum award amount, again, is going to be $250,000 per site. Next, we have, is there a required budget and or budget narrative format for this request? So there is no required budget template. We do ask that you submit the budget in your agency's format. So next question, what level of detail is needed in the budget? Do we need names of specific conferences, etc.? So the budget should be clear. The budget should be specific with identified budget categories. Expense line items could include, but certainly are not limited to any startup costs, in-kind contributions, marketing, resources, and equipment if applicable. So we just ask that you refer back to the proposal for additional details on that. So we will continue with our budget questions. Is this state DPH or federal funding? And this funding is actually ARPA funding managed by SBHA. Is indirect allowed? If so, is it capped? And indirect is indeed allowed. It's a part of the program cost. It is capped at 19.1% and must be in line with organizational policy and directly related to site cost. Next question, are one-time costs included in the $1,000 or, and it is included in the overall budget. Can a request include one-time cost in year one and the rest in the second 12-month period? So keep in mind the budget submitted should cover the funding period through June 2026. However you determine to allocate it, it just has to cover the full period. So now we want to transition into some information on licensure. We just asked, but for the School-Based Health Alliance, has no bearing on or say in any of the licensure process or procedures. So we're just going to direct you all questions, concerns to the appropriate contacts, and that's going to be DPH as well as DCF. And so, as Teresa mentioned earlier, these slides have already been posted. And if you do need to take note and reach out to any of the contacts listed there, we ask that you utilize that information. So now let's go to our next category of questions. So the first question here, does this project allow schools the option of an a la carte service? For example, could the SBHA services be limited to just one or two services, such as mental and behavioral health and health promotion and education, or does it have to be all encompassing? And the answer is yes, that applicants can apply to establish or expand one or multiple services. The next question is, can you explain the expenses for the school? So the cost of the school would really be dependent on your partnership agreement. Types of expenses can range from the cost of water, electricity, cleaning services, but it's really going to be very dependent on each arrangement. Next question, can we look to apply for the same sites that received the first round funding to continue funding? And the answer is no, unless those services at the existing sites are now being expanded upon or adding new services. So our next question, does the term period as outlined for June 2024 to June 2026 allow for the grant period to cover 2 academic years? And the answer is yes. Keep in mind the maximum award amount of $250,000 will cover the 2 academic years. Regarding the SBHA Alliance SBHC opportunity, is the maximum award amount $250,000 per school site per year? And the answer is no. The maximum award amount total is $250,000. Next question, will only SBHCs proposed for schools listed and the PA 21-35 report be funded? Otherwise, to what extent will these schools be prioritized? And the answer is no, it is not limited to schools just in the PA 21-35 report. This RFP prioritized new and expanded SBHCs. The next question, if a Title I school had an SBHC when the PA 21-35 report was prepared, but has since changed the SBHC provider organization after a service lap, will that school be a priority for this funding opportunity? And again, we just ask that you refer back to the PA 21-35 report and keep in mind that the RFP is prioritizing new and expanded SBHC sites. So next question. For existing sites, do we need to add additional staff or services, or can this also be continuation funding to support staff we were just able to hire? This is a new grant with a new timeline and proposal process prioritizing new or expanded SBHC sites. So if applicants apply for expanded or new services at an existing site, proposals will need to clearly indicate, they will clearly need to indicate that and then provide a work plan that supports their request. Next question, if my site already has a partnership with a provider for school-based services, does that make us ineligible for this grant? And keep in mind that eligibility is not based on partnership. We ask that you refer back to the eligibility criteria that is outlined in the RFP. Next question, are we allowed to apply for partial year funding if we have other funding that covers through December? And so this really is going to be dependent upon your individual proposal. This RFP again prioritize new and expanded SBHC sites. Okay, so our next question, can we split a therapist between multiple schools? If so, would there be more than one application for this? And so to the first part of that question, yes, a therapist may be split between multiple schools with one proposal per school site. Next question, what happens if a nonprofit and a school district apply for funding for the same site? So the nonprofit or partner organization, the school district and the school applying should really communicate to ensure a smooth submission process. The school district and organization can apply together. So our next question, are there organizational requirements to submit a proposal? And there are no organizational requirements. Please see the list of subrecipients outlined in the RFP. Next question, is there a funding position limit for this grant? Keep in mind the maximum award amount is $250,000, and we just ask that you refer to additional award information section within the RFP. Okay, so as we near the end of this category's question, we'll start out with our center is not within a school building, but it is an access point for all new students entering the district, as well as current students in several programs. Would this serve as an eligible location? The answer is no. Please refer back to the SBHC criteria as outlined in the RFP. Next question, can the funding for this project replace funding reimbursement that we lose, such as when ARPA funds expire? And the answer is no. Sites in the proposal must be new or expanding services. And final question for this category, how do you define SBHC? Do you mean an SBHC licensed by DPH, or is anyone providing school-based services eligible? An SBHC is located in a school or on school grounds. SBHCs must be licensed by DPH or DCF in order to provide services in Connecticut. And so we have our last category here regarding sustainability. So the question is, in regards to sustainability, do you have recommendations or suggestions for additional funding to supplement the project once the grant period ends. Sustainable SBHCs create strong partnerships with its stakeholders, including sponsorship organizations, local healthcare providers, students, families, and school partners. They have a diverse funding portfolio, including in-kind donations, patient revenue, and grants. So at this time, we are going to transition into some of our resources. Continue to drop in any questions that you may have in the chat. And once we complete this portion, we will go back and have the opportunity to answer any additional questions. So Teresa, I will turn it over to you.
Thank you, Danielle. So yes, just to go through a few resources that are available to you all as you are applying or thinking about applying. First up is our SBHC planning checklist. It walks you through all of the key high-level steps to consider during the planning phase. This is available on our website. So I definitely encourage you to check this out. If you're new to this, if you're new to SBHCs, there's some really great information here. And then the next one we have here is our school-based telehealth program playbook, startup and operations. And this is a guide to guides health centers through the design, implementation, and operation of a telehealth program to meet the needs of children and adolescents in the schools. And it includes essential components for school-based telehealth startup, key considerations from health centers across the country, and then it also has amendable resources that you can use through every stage of the planning. And it does focus on school health centers, but it's really helpful, you know, for all health systems. So that's here, that QR code is there, and the link is there that you'll have on these slides if you review these slides afterwards. So definitely check that out as well. And then our next resource is our school-based mobile healthcare toolkit that just came out recently, a few months ago. And this was developed by SBHA to enhance the capacity of healthcare organizations to integrate high quality, sustainable mobile healthcare services with school-based healthcare programs. And then again, you can access this toolkit through our QR code here, and it is also on our website under our toolkits. And then this slide just links you to a few resources. That QR code will take you to our resource hub that has more than several resources that are really great for really anything that you're doing in your work. If you're doing anything now, again, if you're thinking about applying, we definitely encourage you to check this out. We have a mapping tool, we have our Hallways to Health toolkit, and then a lot of blueprint resources in that resource hub that includes tools, examples, guides, and MOUs. And then we have a link here also to health centers and schools uniting for young people's success. So follow those links to view those, check those out. And then of course, we're always available for questions throughout this proposal cycle. If you come across something on the website, or if you're not sure where to find something, please feel free to reach out to us and ask. And then here we also have some Connecticut specific resources. So this first link links you to the CTTPH School-Based Health Centers page with information specific to Connecticut School-Based Health Centers. Then we have that link again to the PA 2135 report, the expansion working group report, to check out if your school is on that list to see where the high needs areas are. And again, the proposal is not limited to only schools on this list. And then again, we have this link to licensure, which we went over a little bit earlier. So those are all Connecticut specific. And then last but not least, and not the least important, we have our National School-Based Healthcare Conference coming up this summer from June 30th to July 2nd at the Westin Washington, DC Downtown Hotel, which is formerly the Renaissance Downtown Hotel. Registration is now open, so we would love to see all of you there. I know some people from Connecticut are coming, so that will be great to see you. But if you're interested, definitely check this out. Follow that QR code to learn more about the conference and to register. And then again, if you have any questions, you can always email us at ctsbhcfunding@sbhforall.org. Teresa, Danielle, and I all have access to that email, so please only email that email to ensure that we all receive the question or communications about the funding opportunity. And again, we are happy to answer any questions or have a call up until the deadline for this proposal. And then our last slide here is just stay connected. If you're not already following us on social media, please feel free to check us out, and you can register for our digest on our website at sbhforall.org. And I will go back to our open floor for questions slide and turn it back over to Danielle and Teresa.
All right. Well, you all have been hopping in the chat, so I am going to just review some of the answers that were given in chat. There's a question in regards to fringe. Fringe is 19.194%, at or below 19.194%. And then there was a question about community partners and what we're asking for. We're really looking to see community engagement and to see that there's connections in the community. So think of non-traditional as well. Is there a hospital that you work with? Is there a YMCA you work with? Who do you refer them to, and who can support, give support to the work that you guys are doing, you all are doing. So we do ask for 3. If you only have 2, that's fine as well. But again, we're looking to look at community engagement, and applications will be scored according to the feedback you all give us. So think about non-traditional. There was questions about documents and slides. Slides are posted already on the web page. The URL was given. I'm going to post it there again so you can have that. Slides are posted there. The proposed staffing position is a document, so it gives you exactly what we're looking for in that document. The PA 2135 report is also posted there, so you can see if your school or your location is noted in there. And then the Connecticut salary tier is just really a baseline that you could use. It's not that you have to use those numbers that are in the Connecticut salary tier. That was a few questions that were in chat. We want to open up and see if anyone else had any other questions. You can put it in chat or you can unmute yourself and we will help you get an answer. If we don't have an answer now, we'll get it to you soon.
And I just dropped into the chat as well the link to the actual RFP, which is also on that website Teresa just dropped in there. So if you haven't had a chance to look at it, you can get on there and review all of the information and all of the questions at once before submitting.
There was another question in regards to if you have sites that are already DPH funded, if you're able to apply. Yes, you're able to apply. If you have any other funding, you're okay to apply with us. I would say always go back and check with who's funding you to see that you're in alignment with any of their requirements. But I can't speak for us that we are looking at sustainability. That's important. So we're looking to see that beyond these funds, you're able to move forward from there. So diverse funding portfolio is positive in our minds. All right, let's see.
And I see a question in the chat from Katie for the attachment current site information. What specifically are you looking for? And that will only be required if you have existing SBHC sites. So we can, and on that document, there are columns for you to fill out for each of your school-based health center sites, where they're located. And then I think it asks for like current student enrollment, services that you're currently offering, just so we can get information about what you're currently doing at your school-based health centers.
So, thank you, Teresa. The next question I see is if you get funding for the first 2 years, the understanding is that those costs will be absorbed by the district year 3. So one thing with what we do, and I'm sure the folks that received the previous funding, is we're not just giving you all funds. We have training that we're doing, and part of one of the training is that we're going to do sustainability. The goal is that we're funding sites that are going to be sustainable beyond this point. And what does that mean for us? That means that you're able to bill for and get reimbursement. So the reimbursement is supporting, you maybe have diverse funding portfolios, you have other funds coming elsewhere. So we're not saying that it will be absorbed by the school district. I don't know what your background is going to look like, what your budget's going to look like, but the goal is that you're able to see enough clients and it's well situated enough that you'll be bringing in revenue to be able to support it moving forward. So it really depends, and that's what we're looking to see when you submit your budget, when you submit your plan. We're looking at school size. You know, if you have a smaller school size and there's a small percentage that are receiving Medicaid, then you'll have to look at, okay, is this a good fit? Or are we gonna do a mobile unit, for example, or is telehealth better fit than doing a brick and mortar. And why? Because if you have a school that's only at 100, you only have 30% of those students that are Medicaid, and then you're only seeing a small percentage of that number, then you're not going to be able to sustain just given those numbers. But if you have a school that is 80% or more that is Medicaid funded, then that if you're able to see those students, you're able to draw down, get reimbursed, then that will go back to the sustainability. So it's not going to fall to the school. And then looking at, other community sponsors. So is there a hospital? Is there another organization that you can work with? And then again, going back to what kind of services you're looking at. All right, Kathleen, you're saying the form is asking about a smart sheet account. We'll have to look at that and see. Teresa, I don't know if there's anything else that you're thinking for that.
You shouldn't need a smart sheet account to open the form and submit. So I'm not sure why it's asking, but it could be maybe try a different browser, because I know if you're accessing it on mobile, it will take you to the sign-in page for Smartsheet, but you shouldn't need, I don't believe, a Smartsheet account to submit.
And if you are able to stay on towards the end, we can maybe do a share screen and we could see exactly what you're seeing to kind of work through that, or we can jump on another call. And then, okay, from Amy, she comments, we often get asked to be in smaller populated schools that are alternative schools where a student may need additional support. Is there a way we should indicate that as a population of students in number does not exemplify the crisis need? That's a very good question, Amy. You have me thinking. I need to think about the best way to do that. Because I think it depends on what you're asking for in your application. So maybe if we can take a call later and we kind of can talk through a little bit, I think that would be the best way to figure out what you're going to do going into the site, and then to figure out what their needs are. And then, part of it is, are they one of the sites listed in the PA 2135, I think that's the number, to make sure that we're kind of looking at what the needs are overall, because we are looking for need and to fill a gap that's there. So as of right now, I do not know, and we'll talk about it.
Teresa, there was another question in the chat. Is there a rubric used in the evaluation process that can be shared?
Ooh, good one. That's a good question. The rubric is basically we did not share the rubric, but what we're looking at is, I've said it probably multiple times because this is very high, is the sustainability. We really want to make sure it's a sustainable site. We're looking at, is it on PA 2135? And then we're looking at what the need is that you're explaining. Our goal is really going back to some of those slides that we had, is, are we able to fill a need? And then are you able to explain it to us in a way that we're able to support that with these funds? So sustainability is key, being on the PA 2135, looking at the services that you're and the population you're addressing, and looking at the needs in that community. Those are the top items we're looking at. There are other items, but basically everything that's on the RFA, we're grading each one of those and looking for the best answer to make sure we're really being able to fund sites that are able to do what we're asking. So in short, no, we do not share the rubric, but if we go back to the slides, we really highlight what we're looking for. Any other questions? All right. Mum's the word. So we'll go ahead and we will stop the recording. And then if you have any other questions, we'll be on a little bit longer. If you need to set up a one-on-one because you have a more detailed question, please send us an email. We'll put the email for the group in chat and we'll work on trying to schedule a meeting.